So Les Baird, Reverend Les Baird, is an Anglican priest in Yarrabah. Les is the Indigenous Mental Health Suicide Prevention Coordinator at Wontock College in Cairns, and has worked on building family wellbeing, the family wellbeing program into the curriculum of the Cert 4 in Indigenous mental health, specialising in suicide prevention. He specialises in the development of Aboriginal and Torres Strait Islander leaders from his community and has been instrumental in the positive change process in Yarrabah over a number of years. And Les, I just want to read this out, if I get the right report. Where is that report? Matilda, have you got that report? Oh, here it is. So this report, the Family Wellbeing, Empowering Aboriginal and Torres Strait Islander People to Bloom and Grow. In this report, Les, and I have got Les's clearance to quote him, Les said, and I quote, "Many changes started to take place eventually in my life." This is after having been a part of the Family Wellbeing program. When we were doing goal setting, which is an element in the program, when we were doing goal setting, there were two goals I wanted to achieve, and one of them was to get my master's degree, which I've just completed and graduated in May this year, and that was last year. So, wonderful. So I did want to acknowledge that here today. So Family Wellbeing is an effective social and emotional wellbeing program originally developed and delivered by and for Aboriginal people and Torres Strait Islander people in South Australia. Back in '93, the Aboriginal Employment Development Branch of the South Australian Department of Education. And the central objective of the program, Family Wellbeing, is to develop people's skills and capacity to move from a position of disempowerment to empowerment, to take control and to change their lives. So over the past 20 plus years, the program has continued and spread with little formal support, but there's been a proliferation of this program, and it's now nationally active across most states and territories, along with some international uptake. So we've got this homegrown program, organically grown and overseas as well. So Les, if you can join with me in welcoming Les here today.
Hello, is this on? I'd like to acknowledge Romley and Pat for Low-H Institute, and thank you for bringing me here to this panel. I'd also like to acknowledge the traditional owners of the land in which I talk, and I'd like to thank you for allowing me to be here to talk. It's a bit difficult to talk about 10 years of work with family well-being in 10 minutes. So I'm just going to give you just some case studies, including mine, as a result of family well-being. I was the health manager for the development of community-controlled health services in Yarrabah, which is now called Girinya Yilamaka Health Service. Family well-being was introduced into Yarrabah through the men's group in 2001, and I was a part of when family well-being was introduced. We were introduced into the first stage, and the first stage covered a lot of the topics that was affecting our people and had issues to it. The topics were leadership, basic human needs, relationship, and when we went through basic human needs, one of the ladies who lived in a tin shack house outside of the community with all of her kids, and some of her kids were sick, she came to do the family well-being, and as she looked at the basic human needs, she's seen where she was lacking, and she didn't have proper housing for her kids. So before that, before family well-being, all she used to do was complain about the council is not doing anything for people living on the outskirts of Yarrabah, because there's many people live in tin shacks on the outskirts of Yarrabah. So when she came to know family well-being, and she was empowered to start to do something, and so she started writing letters to the council about her condition, where she was with her family, with sick members of her family in a house. And council started to listen. They, the area where she was, it was outside of the town council boundary, but then they extended their boundary out to her area where she was. And what happened after that is the council was able to take her and move her into a demountable house, which was at least a beginning step for her. And then now today she lives in a brick home, provided for by the council. And so that's proof about the family well-being program that it has a powerful effect on people. One of the men from men's group, they, like in communities, you have some men who have lots of alcohol and drug problems. One of the men who came along and started the family well-being program, although he still drank, he made decisions. He looked at his life journey and seen where his life journey is, and he made decisions about purchasing a car and a boat and taking care of his family. One of the other guy, my sons from men's group, he wanted to do some university studies, so he did his graduate diploma in Indigenous health promotions at Sydney Uni, and he graduated with his diploma. Myself, I failed second year high school. I didn't complete second year high school, and I never used to think that I could do anything. But when I came into knowing family well-being, looking at my life journey and where I wanted to go, there's two things that I wanted to achieve, and that was to finish uni and to write a book about my work in Yarrabah. So in 2012, I went to Sydney Uni, did my diploma in Indigenous health, specialising in substance use. And then 2013, I did my master's degree in Indigenous health, substance abuse, and then I graduated from Sydney Uni in 2014. And so the program of family well-being has a direct effect that can lift you up out of poverty and put you into a place what people take for normal, like the lady getting accommodation, the men dealing with some of their issues. My son had domestic violence issues, and so he had to deal with those issues. And it is through the empowerment, like family well-being is a program that empowers people to think about their issues and to start to deal with their issues. And then they're able to look at how they're going to plan for the future. What would they like to do for the future? And then further development, like my son went on to developing a men's dance troupe, and they wanted to do professional dancing and to be able to bring in tourism into the community. And so I worked very closely with the men's group on culture, And so it's all these works that came out of family well-being. And I think family well-being, it's not going to go away, it's going to grow. And I've attended the family well-being roundtables in Adelaide and in Melbourne, and this is out of the recommendations. One of the recommendations is speaking to policymakers, and this is, I think Lowicha Institute, has a big role to play in research, because like when I first went to Yarra to be engaged in research, the people said, why research, you know? What, they're not going to get their PhD and they're just going to leave it on the shelf. What's going to happen to us? And so I became engaged in participatory action research, you know? And with Dr. Kamala Say and his team, with Janya, Mary Whiteside from Melbourne University, with all those good people that we work together. And, you know, like, our community needs something, and family well-being covers two things. It covers personal healing and empowerment, and it builds the capacity of people to think about our people, to think about their life and what they need to do about their life. And I'm grateful that, you know, Luicha is playing a major role in promoting the family well-being program, because through the Adelaide conference, we were able to come together with researchers, policymakers, and discuss about the different like family well-being programs happening in different parts of the country. And you could see out of the success stories how successful family well-being is. Thank you.